are you doing today? I'm glad you're able to join us and be at our board meeting today. I'd like to have a moment of silent prayer meditation before we begin. Well, as I mentioned earlier, this is the Department of Social Service Board meeting today, and again, glad to have you all listen to us today as we have some very interesting things to discuss today. Are there any revisions to the agenda today?
No, there's not.
None. Okay.
I move the agenda be approved.
Okay.
I second that motion.
Okay. The motion has been made and seconded. All in favor? Aye. Thank you. It's approved. Okay. Now, let's see now. In terms of the minutes of the previous meeting,
I offer a motion that we accept these minutes as presented. Second.
The motion has been made and seconded. All in favor say aye.
Aye.
All against? I would like to say something about the minutes. I read them and they seem to reflect a lot of the issues and things that we on the board had asked for, as well as the thoroughness, and really wanted to say that we do appreciate that, and we did read them well. Next, we're going to go on to the status of agency personnel. It's going to be you, Mr. Perry.
At this time, we would like to welcome Ms. Susan May, sitting at the end. She is the new personnel technician as well as administrative secretary for my position. So we have combined those two jobs into one. She will be doing the clerk to the board as well on those meetings. So we're glad that Ms. Susan May is here today, and she was the one that did the minutes for this meeting. Also, we want to welcome Mr. Dwayne Holder. This is his first day on the job as the deputy county manager and the chief financial officer for Pitt County. So Mr. Dwayne Holder will be sitting in on the meetings as a representative from the county manager. And as we go through our vacancy report, we have filled 8 positions since our last meeting. At the present time, we have 17 positions still vacant, but we're in the different phases of interviewing, screening. So we should be able next month to show some more movement on that. Of the 8 positions that we have vacant, 3 was filled in-house with promotions, and 5 are new employees coming from outside of Pitt County government.
One of the things I wanted to mention that we on the board had talked about, we were concerned about the number of new hires coming from outside the agency, as well as people that are being promoted, and really appreciate that on page 2, where we have an idea of the new people to the agency, as well as the promotions. So again, thank you for that. Next, we're going to have a budget amendment.
Yes, sir. We received $752 from Progress Energy Neighbor. We also received a few dollars, $399 from Home Community Care Block Grant. I rolled forward special adoption assistance funding in the amount of $22,000 that we got last year, but we hadn't spent it, so it still can be spent in the new year. And then we also received money from the Workforce DOT Transportation Grant, $4,766.
did all four at one
Yes, sir.
time, all right. Okay. Next, we're gonna go to the, reports to the, board and, holiday cheer.
Good afternoon, everyone.
You probably missed the discussion. We're all new at this, I guess, but we missed any discussion that anybody had on each of those budget amendments. Was there, I see where DOT had the $4,700 one. We approved it with no county funds, so it is approved. But could you describe what that does for our department or how that affects us? I know it's in Work First.
Yes, sir. It allows, Margaret's program, her Work First program, to provide some transportation. You want to tell them exactly what?
We send in an application each year. It's submitted by PATS. There's three parts to that. The monies that come down is a TAP, which is monies to use for elderly and handicapped people over a certain age that aren't Medicaid, that need to get trips places. There's a section for employment services funds, which is what we're talking about, this $4,766. And then there's one other category that I can't remember what it is.
Rural grant.
Oh, yeah, rural general public, thank you. So there's three sections. So we, ask for some money. It allows us to help people get to employment-related type of situations, in job interview, job readiness, GED, can help a family with the cost of daycare transportation. So there's three things distinct things we can do with that employment services dollars.
Thank you for that explanation.
Thank you.
Let me ask you a question. Do we still have the program that we try to train and get people off of welfare and for jobs and so forth?
Yes, sir.
And what kind of success have we or do we have pertaining to this program?
I think I shared with you last month that the Work First, employment services.
And that's the reason I'm
right.
asking this on kind of
Employment
that.
services, there's two pieces to that program, the cash assistance piece, which is the check, and the services piece that helps people become engaged in federal and state activities to move towards self-sufficiency, whether it's education and training, job search, those kinds of approved activities by the state and federal government, yes.
Is it possible that you could give us some idea as to the number, such as we are assisting in this particular venture?
I can give you, next month, if you'd like, we could do an updated report on that and let you know the numbers around that are coming to apply for Work First.
Yeah.
They're averaging.
I think it's a good program, really.
Well, the one.
Because people don't really want to be on welfare. I don't believe it. I think they'd much rather be working than to.
When we do our goals and objectives, there's one part in there that talks about employment services, the number of people that we have put to work and the number of months that they have stayed off of work off of welfare. So next month, we will highlight that when we turn in our goals and objectives. Those are one of the things that we monitor, and that's one of the things that in our report that we give to you, but we will highlight that next month.
I think the public, many of them don't understand that we are trying to help these people find employment and trying to get them trained for those positions, which I think is very, very good.
Is it appropriate for me to make an appointment to come in and fully better understand that program?
Yes.
Would it be
I'd
appropriate?
like to.
It would be great if you did.
Okay.
Just call them
Wonderful.
every time.
Okay.
That's all I have.
I think that's a good idea about getting the number of people that have been helped, as well as the number of months that they have stayed on the program and their employment history.
And I do want to ask this though.
He thought he cut it off. No, he
did.
really did.
He did.
tried.
He worked on it.
Do we help them go to Pitt Community College? It's a fund for these people that we can help send them to learn a trade?
Our TANF funding does allow us to do that if it's an appropriate component for that individual. And, the one thing that's really impacting anybody on Work First right now is that we don't have daycare funds. Okay, that's hindering their participation in many activities. When we don't have those funds, it's not mandatory that they participate if we can't provide the support services for them to participate. So we're getting some numbers together on that, which we'd be glad to share with you next month also.
Great.
And I want to find out something. I talked to a lot of teachers, and teachers tell me the reason that a lot of students are still going to school is that those students have to go to school for that parent to get paid for that child. Is that true?
There is a regulation in the Work First that your child has to be in school, yes.
And if that child does not go to school, then they don't receive that payment.
It's a partial. They're not cut off Work First. It's reduced by a certain amount.
This is where I'm coming from. I was a classroom teacher for a long time. And we like to have students that really are there, they want to learn, get something out of it. Is there any way and do we put a stipulation that they've got not only to be enrolled, but have to really go to school and to achieve something?
They have to be attending school.
Well, do they have to pass? That's what I'm talking about. In other words, I have had, and any teacher would have, you have students that are going there and they just occupying a seat.
Attendance, yeah.
And that's not good. They need to be learning something when they're there. And so what I'm asking is, can we or do they have a stipulation there, whereas that these students will have to take and do work for that parent to take and to get that money? Because let's face it, one of our biggest problems is the homework of students that we have. And they can make them go to school. They can't make them learn, of course, but they can make them go to bed at night and not look at TV all the time and out on the streets all the time, but get up homework.
Mr. James, I cannot recall getting back into Work First again after a while. Anything in the federal or state regulations that mandates that they have to pass or get a certain grade point average?
So that's,
I don't know.
So that is, in other words, all we can do is make sure they go to school. Okay.
That's attendance.
Yeah, it's attendance.
Yeah, but they don't realize at this age that they are there, that is so important that they do something for the future of their lives.
Oh, yeah.
Okay. One
of Mr. James's early questions was, could the funds be reduced? And the answer certainly comes off of a formula. Have you had to do that? Are there any cases that we have done that? And if so, what is the range that a parent might lose if the child does not attend school or drops out? Is it 2%? I know there are some percentages when people are paying back things, 10%. What would someone be subject to lose in a range? I know each case is somewhat different.
I think you get your cash assistance check is based on if you have 2 people in the family or 3 people in the family or 4 people in the family. So if that one particular child is not going, it's reduced by 1. Like you didn't have that one person on your case.
Okay, so it is by the family
So for
unit.
example, if it's 3 people, you get 272. I think that's still correct. If you reduce it by 1, it's 236. Okay. So it's like getting a check for 2 people instead of the 3 that are actually in your household. But I believe that child still maintains Medicaid. They do. He's not cut off Medicaid.
So I guess what we're saying is that we're feeling that some of those funds should be related to school participation school attendance, and in what Eugene was saying is how well that child is participating. Is that?
Yeah.
Is that,
See, I know we all have different abilities, but so many times we don't use what the good Lord has given us to our advantage. And that's what we need, and parents can influence that a great deal. Of course, you know that, and I know it.
If I heard the answer correctly, there is not a federal guideline or state guideline that relates to what they have to achieve. The criteria that they use is attendance, is that they're there.
That they're my body regardless of what they do or not, whether they misbehave, or whatever it might be. That was my concern, is that
But
they
if
go
they
there.
misbehave, you can ask them out of the classroom.
I think under those circumstances, it's a lot of coordination with school social workers, because they have social workers also, counselors within the school system, to deal with some of those situations. It's a collaborative effort.
All right, any further discussion? I think that was very good to bring those things up, because I think people were thinking about that. I think that was good that we did address that. Okay, next we're gonna move to holiday cheer. Okay.
See, Dr. Hamilton, that you must be equally as excited as I am about this one.
Oh, it's I'm jumping up and down. But it's a very good program, because it's something where we mobilize the citizens to do things for other citizens who are a little bit less fortunate.
And I will again say good afternoon to everyone. And I'm pleased to share with you that as far as the history of Holiday Cheer or our Foster Children's Christmas Project dates all the way back to one of our DSS board members. Our newest member, Miss Becky Starkey, actually started this program with her mother several years ago, and I don't know how many, but before my time, they started.
You're saying, playing the
Before
same.
your time.
So I do give thanks to Ms. Starkey for, as a social worker, for having the dream and the goal to be able to do something and to want to do something like this. And it is something that we have carried on for several years. And to let you know, we are still completely responsible for making sure that, you know, all the children that we have in our legal custody at the time, that we are responsible for them. And your number says 102, but just like I always tell you, that can change. And it did change after the printing of this. We now have 103 because we did get a child into custody last week. And as far as you all and the viewing public, we can be helped one or more of 3 different ways. It can be by sponsoring a child. When they write out their wish list, we can have a child sponsored by that wish list. Can also purchase new unwrapped toys or clothing items and just bring them to the agency, and we will use them as we see fit for any number of the children that we have in our legal custody. And you can also provide a financial contribution that can be in the form of cash, check, or money order made out to the agency. Anything that we receive, you need to send it or call us and we can let you know, but you can send all donations and contributions to Pitt County Department of Social Services, 1717 West 5th Street, Greenville, North Carolina, 27834. And please earmark it for Foster Children's Christmas. If you have any questions or you have any comments, they can be directed to the agency. You may contact me, Mildred Daniels, at 252-902-1134. Does anyone have any questions regarding this that I or Ms. Starkey may answer?
What is the deadline? I didn't see that here.
We don't really have a deadline because it's something that we do from year to year, so anything that may just possibly be left, we can use it for the next year. But we would like to try to get everything that we can the very early part of December so that we'll have time to put everything together, know exactly what we have, get it delivered out to the children.
Is Toys for Tots supported this?
And no, ma'am, this is completely Department of Social Services, and we have no connection.
Because that's the
with
only
them.
one I hear about most of the time, Toys for Tots.
Well, you can talk to me, and I'll let you know about our program. Yes, sir.
Daniels, welcome back again, as each year. Let me ask you, the number, and it does fluctuate, but how does that compare, and I'm thinking about the economy, how does that compare to the number of children that would have been served a year ago or 2 years ago? Is it steady, or is it a trend upward, or how?
It actually does kind of fluctuate. If I remember correctly, I think last year we had maybe like 90-something, 94 or something like that. And that was the number that we had at the time of the report, which, you know, like I said, it can always fluctuate. But in the past years, we were much higher. I think one of our programs, our MRS program that we provide at the agency, that's looking at actually trying to not have to service as many children in the legal custody of the agency, because services are put forth maybe before the child has to come into the agency's custody. So I can say that, we're trying to follow that program. We've been following it for a number of years, and maybe that's one of the reasons that we happen to be kind of down right now as far as where we were a number of years ago.
Mildred, you may want to point out that the Department of Social Services makes no contribution toward the Foster Children's Christmas whatsoever. It is totally done by donations, private donations, and the money comes in and goes into a special fund that is used for the foster children. And in addition to that, I am assuming that there are still individuals in the community. I know that Parker Overton, with Overton's Sporting Goods, used to allow us to go on a shopping spree, and he would let us have things at wholesale prices for our foster children. And are there still individuals that are donating shopping sprees?
Right now, we don't have the luxury of having a shopping spree, but we do have a number of contributors that is almost a yearly ritual with them. When we look at our list, there are certain names that you just know will be on there from year to year.
And you still send out letters, usually the beginning of October, to your donors, and you add to that list and you subtract from that list. But it is an ongoing request for contribution.
We do,
It's very effective in this
and
community.
actually, Ms. Dixon may have writer's cramp from having just recently signed a bunch of them that, we've sent out to the public. Any other questions?
No, other than that, it's, again, a really, a good activity, and I really feel that it helps a lot of the children, because without this program, a lot of the children would not get most of the things that they wanted. So I really, I'm really very proud of that, and I really encourage all of us that can to participate in this program.
And I think that's why it's one of such a great passion of ours, is because if we didn't do it, we wouldn't have it done, because there are no county, state, or federal funds, and nobody comes in and take it upon themselves to make sure that our children are provided holiday cheer, so they can, be equal to their classmates, whether it's a daycare, first grader, 12th grade, or whatever. But as long as they're in our legal custody, we do make sure that they are provided holiday cheer during the holiday season.
One of the things I'm wondering, I know Mr. Mayo asked this, compared to last year, what is this number like this year? I think you were asking something like that.
Right, and if I can remember correctly, like I said, I think it was like 94, maybe
94,
95
okay.
last
So it's
year.
going up. So the economy is impacting less.
Yes,
Okay.
and we can see from our donations situations that, you know, there are some names that we can't look for, but, you know, we do have a number of names that from year to year, and, you know, probably a lot of them Ms. Starkey would remember, because it's become a passion of theirs too, to make sure that this program is successful.
I think a key to that, as we sit here and hopefully the viewing public, the key to it is them and how well they and their churches and all their groups and the individuals will participate. It's our job to get the knowledge out to them that here is a need that is not governmentally funded in any way, and so we do need your help.
That's correct. Thank you.
Thank you. Okay. Next we have Ms. Cynthia Ross, who's going to be doing the adults.
What we'd like to remind the public is that Pitt County Department of Social Services is also the legal guardian of over 60 adults living in facilities. These adults also are in need. Pitt County Department of Social Services is their only resource for making sure they have undergarments, making sure that they have simple things, personal care items. Sometimes it's just a pair of shoes that don't last them 2 and 3 and 4 years, and they need to be replaced. We have members in the community, families that choose to sponsor individuals and get great pleasure out of going to the facility, visiting the adult, and have really had the opportunity to understand what giving is across the spectrum. Sometimes our adults get forgotten at this time of year. So we take the opportunity to have a very similar project. We sponsor our Pitt County legal guardians, and then we also extend that to those that are in facilities that are in need, that don't have any family, anybody at all who visits them and is able to financially get them a few items. And it just brings great pleasure to them when we have the opportunity to take the gifts out. Church groups have sponsored, and year after year, people's work offices kind of get together and purchase items and collect things. We have Girl Scout troops that have gotten together and taken the opportunity to go visit a facility and sing some songs. So it's a win-win for everybody who gets involved in the project. We take monetary donations, we take personal care items, unwrapped gifts, anything that anybody would like to donate for this population. Our contact individual at the Pitt County Department of Social Services for this is Retta O'Quinn, and her number is 902-1205, and she will take those calls. We'll do anything we can to help and make it pleasurable for everybody. Come out, talk with groups about what our adults' needs are, and help make that special connection for anybody who's looking to sponsor any adults.
Is there a wish list for the adults similar to for the children?
There is. What happens when people want to sponsor a specific individual, we can give them actual information, clothing sizes, what that individual needs. One year we had a gentleman who was in an assisted living, and his wife had gotten into a medical crisis and ended up in a nursing home, and he was still able to drive, and what he wanted more than anything was gas for his car so he could go visit his wife. So we do have some very special cases that have some specific needs, specific clothing sizes, and sometimes it's a specific food item that they love and they don't get because you have to eat what's given to you every day. So sometimes somebody just wants some bananas. So sometimes there's some things that are very, very simple wishes for this population, and it can mean a lot to them. So we're happy to join people with a specific resident and a very specific need, but as far as general needs, they always need personal grooming items. Shaving cream, deodorant, all of those effects are things that they have to buy. They're not provided. So those are always items that are in need. Undergarments, socks. If anybody can imagine living in a facility where laundry's done together and your socks at home disappear, well, their socks disappear. So just having underwear and socks is something that is so special to have on hand. So those are some general items that all of our residents need.
I have a question to three.
Yes, sir.
The gentleman that I was talking to you about, he's much over 60. but he lost his food. He couldn't get food stamps. He's lost his papers. And here in yonder, how does he do food stamps when they lose the paper and so forth?
Yes, sir. Through the food stamp department, they have applications that can get mailed out.
Yeah, well, that's what I told him. He said he wasn't getting any help. All right, the next thing, and I'm glad to hear that, and so that's all that he has to do. The next thing, senior citizens such as that, Meals on Wheels. How did they go about getting that? Because, you know, they get a balance meal once a day. And when you get that old and you get that balance meal once a day, you're doing pretty good. But there are lots of them that are not able to take and to get that. What procedure would he have to take for him to take and to get that carried to his home?
Meals on Wheels is provided through Council on Aging.
I know.
So you contact Council on Aging, and then it's going to be dependent on their routes.
Right.
So I think that's a program like many programs that are affected by the financial situation. They depend on drivers who pay for their own gas in order to cover routes. So when you contact them, they look at the criteria to determine if somebody's eligible for that program. And
So
they
there are
have some
certain
criteria.
places in Pitt County that they will not get it regardless of their need, is what you're telling me.
Depending on whether they have a route available. Like they may have a driver who goes to that area, but they have a limit of how many they can serve.
In other words, there's nobody in social services or the social services department do not head that up to make sure that these elderly people. No, we do not head that up.
That's through Council on Aging.
They're stricter on the council on aging.
Yes, sir.
Do you all get much money from council? But I know they don't have much money to begin with. Mid-East, they get that money from Mid-East. What part does Mid-East have to play in this particular undertaking? Do you know what I'm talking about?
I would not know how much money Council on Aging gets.
Yeah, but I mean, this is part of social services, so to speak. I mean, it's welfare of our senior citizens.
Yes, sir.
And these, you know, we talk about the young, but you got these elderly people out there that are in much worse shape, so to speak, because we say, well, they're old, but when you get old, you're more conscious of that. Than we are when you're young. All right, so I would have to go to the Council on Aging to find out about the Meals on Wheels and so forth. Okay, if you live in the wrong place in Pitt County, you're in trouble. That's what you're saying?
Very much. But I think the answer would that to be if there's a certain area and you have a gentleman or somebody who's interested in services in that area is finding a volunteer. If Council on Aging has a volunteer in a certain area, then they will, you know, that's the key is locating a volunteer to serve an area. How do they go about
volunteering? Because there is a town in Pitt County that seems to be the forgotten area of the county.
Yes, ma'am.
And it is important for the general public to know how, if there is a volunteer in that area, that you may be able to bring resources. So how do they contact? Who do they contact? And that would be good as a social service function to get the information out.
The Council of Aging would be one of those contact places, Pitt County Council on Aging. And then certainly somebody can contact us at Department of Social Services, and we can try and, depending on the town or depending on the particular service that they're interested in volunteering, we can try and give them that contact information.
Before you go, you gave a number and a contact person for the adults. Could you do that again?
Yes, that is Retta O'Quinn, and her number is 902-1205.
All right, thank you. Next, we're going to move on to the daycare business plan.
Last month, we shared with you that we would come back this month with a business plan in place that would be and has been submitted to the state at their request. We received a request from them in September to put in a business plan in place for the remainder of this fiscal year, and hopefully we put together one that has the least amount of impact on children currently receiving subsidy funds. In your packet packet, the format follows specifically how the format was laid out to us. The questions that are answered were those that the state wanted us to answer in the business plan. For example, the savings from savings from children returning to school that were school age, other programs in our community that serve school age children, savings from NC pre-K programs, number of families and children that would age out at the end of December, because we don't serve children once they reach age 10. Some of those questions I shared with you last month, what our reduction looked like. That was after school to part-time children, and then first off was our plan. I'm gonna, PJ's, if you don't have any questions about the answers to these, we'll go to the chart in that packet. It looks like this. Okay, and PJ will go over with you where we see ourselves going in the reduction that we need to have each month and how we plan to get that reduction. So,
As you can see, the first 2 months we were pretty high. Our spending was very high from what our straight line spending should have been. But come August, we were projecting that we were going to be down to the 725. We missed that by a little bit. We ended up our actual was $748,000, give and take a few. And we're basing our reductions each month on things that we know that will happen. For instance, in August, we knew that we were going to have 5 days of the month where the children had returned back to school, so there would have been less payment that month for care. And then we also figured that we would probably see approximately $25,000 reduction because of children aging out or people no longer needing daycare and that kind of thing. And as I said, we missed it just a little bit, but then the next month for September, and I'm not going to go through every single one of these numbers, but I do want to tell you that for September, we were again looking at, we knew kids were going to go back to school, so we knew we would be starting probably about $125,000 a month reduction in expenditures because the children no longer needed full all-day daycare. And we also thought we would probably save another 15,000 or so for children aging out, turning 10 and that kind of thing. I looked at the daycare. We're in the middle of doing the actual daycare payment for this month, for August service. September services paid in October, and it looks to me like we're going to be right around the $600,000 that we've projected, and that's a good thing if we stay there, because then hopefully our reductions that we're looking to go from then on out will materialize with the dollar amount that we were hoping to have. Now, January the 1st is the first month that we're expecting to have to start letting children no longer have the daycare. And as she said, it will be after school kids is where we start. The last ones that we put on will be the first ones that we take off. But I think if we continue to realize our reductions as we see them, as we've got them projected, and like I said, for the month of September, it looks like we were very close to where we're going to be. I think we'll be okay by the end of the year to get down within the funding that we have from the state to be able to pay.
The letter that you sent out pertaining to the providers in daycare, what response did you have from them when you asked them to work with you to lower their rate? Did you have, what kind of response?
I myself have not seen any letters back. I did hear that at the meetings that the daycare unit held, that there was several, I don't know how many, that indicated they would be interested in it.
Yeah.
nothing yet.
But nothing
Yet.
No.
To me, that's the right way. That's the reason I was asking you before, star 5 and down. Is there any way, because we need to service as many of these kids as we possibly can, there's no way you could drop a whole section off of that, could you, the top one, the top layer?
No, sir.
There is no way at all that you could do that.
No, we have
But
to.
I think it would be wonderful if those people would follow the recommendations that you are talking about so that we could serve more of these students because they need help. They really do. The parents need that help. They're trying to out there to get a job, make a living, but if they put them in that daycare center, it takes all their money that they make to take in to pay for it. So they don't have that incentive to take in and get in there and do another job. But I think you're on the right direction. Maybe we'll have a response. Maybe you need a follow-up lawyer.
What about a telephone call?
Yeah,
Maybe a telephone call.
but I think it's well written. I think it's,
I'm not talking about the writing. Sometimes
yeah.
a letter get lost in the papers.
Oh, yeah.
I know that this particular letter that we sent out was actually handed to the daycare centers that attended the meetings that we had, was it last week and the week before? Each daycare is required to come to these meetings, and so pretty much all of them actually, I know, got the letter because it's
So
handed to
you
them.
make sure that all of them get the letter,
Uh-huh.
mail it or by personal
Right.
contact. Let them know that this is a way that we can help. And what would be nice to say, if you lower yours, then you might get an additional child. Or at least you won't lose any.
I don't
I mean,
think-
wait a
That
minute.
letter can come from you, is that?
I would say it.
we have to,
We try not to put additional
Yeah.
children
I
on
know.
us.
One of the things that I wanted to say, and some of us have talked about this report, is that it's extremely proactive. It lays out exactly the kinds of savings as well as your strategy that you're looking at to make some of these cuts and to handle some of the changes in the funding, as well as what are you going to do next. And you've got a letter out that is very much proactive, because what that's saying is these are the issues that we have, these are our funding issues, this is what we'd like you to do for our providers. And I think that is very good, because it helps us as board members understand things a lot better and to see your strategy and that you are being proactive. And I really was impressed by that.
As was I. This is one of the best laid out plans I've seen on a change like this in a while. I would ask, from a fiscal point of view and from the states, as we read through that, we saw where you submitted the plan and the state is accepting it. At the end, and the plan shows coming into compliance by the end of the year, hopefully by May or June, considering that the state's year is July 1 through June 30, is there any implication for us as an agency? If I look at that corrective plan, looking at a whole year, we would have still been over by
yes, sir.
some. Is there any kind of financial liability or anything between us as an agency of the county back to the state if, let's say, at the end of the fiscal year coming up June, we have it now in order, but let's just say we've spent 110 or 12% over, there would be no risk of owing back, would there?
Well, you wouldn't owe it back, but it would be all county dollars. And let me say that the funding for this particular program, the state's fiscal year is 1 July to 30 June, but in actuality, it's really 1 June through the 31st of May, because everything, what we spend in July, when we ask for it to be, what we spend in June, when we ask for it to be reimbursed in July, it comes out of the New Year's money. So this plan is getting us down to live within the money that we've got to spend through the end of May. And if we overspend what we have, then it becomes 100% county dollars, which.
He's not going to like it all.
He's not going to like
He's not going to
Right.
like it. So therefore, we want to abide by the budget.
Wanted to tell you
Yes, sir.
early, though.
Yes, sir. And that is our goal. And I think, like I said, based on September coming in really, really close, unless something I don't know about right now changes, I think we're going to be okay. But we will have to reduce some number of children. And if you read in here, you saw the numbers that we were talking about. It may be a few less, it may be a few more, but there will be a reduction in the number of children that are actually receiving daycare. The state received $17 million less in funding from the feds for daycare this fiscal year than they had in years past. And of course, that comes down to the county, and that's why we have less money than we had before. And the state assures us they have nothing left to give us. $111.19, I think, is the number that the state has got on hold at the state level. That's $111, not $1,000.
I wanted to say also that, you know, a lot can happen in these months, you know, that will change this plan from month to month. Before we, again, even though we've submitted this plan, before we reduce any children off, we are to notify Raleigh about that. But I certainly would like to give you an update on this on a monthly basis, if that's okay, so that you know
We'd really
how this
appreciate
picture
that.
is going to evolve and
What
that
my,
kind of thing.
what my intention for updating for the next things is just to update this chart so you'll see the actual and what it does from there on.
Yeah.
Thank you.
Spending or savings take into account any assumptions of rate negotiations with providers?
No, sir, not at this particular time because we didn't really have
Okay.
a feel for it.
So
And
depending on their responses,
that
these
could
could be
change,
accelerated.
could change a little bit.
There were two things. One is, I'm not familiar with the term straight line projection.
Oh, I'll tell you what that was. We had X number of dollars for this fiscal year, and I forgot off the top of my head what the total
Okay.
number was. I just divided it by 12. That's our straight line. If we were to
Okay.
spend the same amount each month, we would end up spending what we had, and that's what I mean by straight line projection.
Okay. The other thing, I wanted to tie in with this budget, something that Eugene had brought up earlier. How will these numbers affect the children of work-first parents? Will they be affected by this? Will there be more?
Well, as I said to you earlier, in the Work First program, there's in policy, because they utilize subsidized daycare funds, and depending on the availability of that funding, okay, if it's not available, there's a code to code that family that indicates daycare funds are not available. And they're not mandatory to participate until daycare funds do become available.
Could you guess or tell me, with these cuts, is there a number or an idea of how many work-first parents would not be able to have their children in this program and therefore not be able to participate in Work First?
Funny you should mention that because Sharon and I are putting those numbers together right now, and that could be part of what we report to you next month. Okay,
Yeah,
what
yeah.
that picture looks like.
Yeah, I think that would be good because I think if you were talking about the participation of the children in that program and how that affects what the adults are also able to participate in that program, that would be something that we'd like to know.
Now, we made an agreement that if a Work First participant was offered employment, that we would provide the daycare. We could not really, in good conscience, say, you've got to turn that job down because we don't have daycare. I think, number one, we won't have that, an onslaught, and I think with natural attrition, we certainly can absorb 1 or 2 a month. But certainly, if anybody's offered a job, we want them to be able to.
Okay.
And then you find a way to get them out of that and self-sufficient. I think that would be wonderful.
Yeah. Any other discussion on this? Again, I want to really emphasize how much us as board members like the report in terms of the kinds of things that we're talking about and needing to make our job a little easier, as well as so that we can explain it to the citizens of Pitt County, because we're always getting questions at some point about that. So again, thank you very much. Next, we're going to go up to NC Fast update.
NC Fast is an automated case management system, which we've talked about here previously, that is being implemented statewide. and it is being implemented in the Food and Nutrition Services Program. Currently, applications are being processed in the first phase of the project. And in Pitt County, we had our staff had training in August and September. The last training was held the week of September 10th. So staff have been using this new system for taking applications, transitioning to the new system, but at the same time, in order to get all the work accomplished, some applications are being processed in the old system. It's set up this way so that staff can become comfortable using the new system, and there's a transition period rather than starting from the beginning only with the new system because of things that might have to be worked out with learning the new system. We are in phase 1, and we've done a soft launch of taking applications with NC Fast. And in the month of September, we processed 697 applications, and 370, or 53% of those, were processed in the new system. Our hard launch for using NC Fast to process applications will either be November, December, or January, and that will be determined by the state after they have reviewed our progress in using the system. So our goal is to continue increasing the percentage of applications that we're processing in the new system each month so that when we do have the hard launch, we'll be equipped to process all applications in the system. The positive side of this change is that it eliminates a lot of the paper forms that have to be filled out to determine eligibility. When a client comes in for an interview, the client sits down with the caseworker, and the caseworker interviews the client, inputs the information into the automated system, and then once all the information is verified, after it's been received from the client, the automated program determines the food and nutrition services allotment rather than manual budgets being calculated by hand using calculators, at which then the information would be input into the system, the old way of doing it. So as long as accurate information is being entered into this program, we have a better chance of having an accurate result. It will cut down on errors of doing calculations and determining budgets and determining a food and nutrition services allotment. The state's plan for this program is eventually to be used in the Medicaid programs and in the Work First program, but that would be some years down the road after the state determines how effectively this new system works for food and nutrition services. And we have posted in our lobby, and we have, in talking to clients that come in, asked patience and cooperation as we transition to this program, because since staff are learning a new system, the processing time is not going to be as efficient as it was under the old system until we can transition to the new system. So there can be some delays expected in waiting to see caseworkers, and also the processing time of applications. But I'll still emphasize, and we talked about a mail-in application process earlier, for those clients who are unable to come into the office, there is still the option of having an application mailed. The State Department of Health and Human Services website, which is ncdhhs.gov, that website has the Food and Nutrition Services application there. There's not a method right now to transmit an application by email, but the client can process the email, print out the application, and then complete it and mail it into our agency. So for those that cannot get in, this does not eliminate ways of applying. We would simply take an application that's mailed in and then have that information put into NC Fast and have the case processed.
One of the things that I was thinking about as you were going through this is that you had kind of been preparing us as board members that this was coming up, and you were talking about some of the things that you could expect. One of them was that initially it would be slow, but eventually it would get faster as well as more accurate. What do you think about I'm just thinking about the error rate, because there was some concern about that with the manual procedure earlier on.
I would think that it should, in the long term, help the error rate. Our focus, once we're using the new system completely, and has always been our focus, is any information that's put into the computerized system needs to be keyed accurately. So our focus would be to be sure that what we're putting in, our keying is accurate, and then that eliminates the piece of the manual calculation. So that's another piece eliminated that we would not have to do manually, where that would also be subject to error.
Okay. The other thing with the new hires that you are having participate in this, how is that working now?
Well, the new hires have not actually had the NC Fast training yet.
Okay.
They are being trained to assist right now with recertifications. So the new hires, we have hired some that are being trained in food and nutrition services policy, but they are already assisting the current staff in processing recertifications, which is still using the old system. And then once they have training, they'll be able to use the new system for applications. So we already are being able to use their abilities to work with recertifications currently.
Okay. One other thing, how is your staffing in this program?
You mean how many vacancies are there now? Is that
Okay,
what you're
yeah.
asking? Yeah, okay. We have 2 positions that are vacant that we have just received the applications from HR on, and we'll be looking at those. So they will be the next ones coming up to be interviewed, and once we fill those 2, then we'll have full staff in food and nutrition services.
Okay.
So we're almost there.
Okay.
Brian, wasn't there some support from the state? Because I remember in the regional meeting that they had people they had trained and tasked with that they would loan, or?
They are making visits to assist with troubleshooting and to assist the staff with working through the process. They have been on site doing that some,
Okay.
yes.
When you have to do, Bryan, quality monitoring, once this gets in place, now that would not account for if an applicant gave you misinformation. But wouldn't there be a way that would cover some of that monitoring, we'll say months out, a year out? Because if you had more issues coming, and I assume it's coded, so, or you have codings in the office so that the person putting it in is identified?
That's correct.
On
Yes.
each applicant?
Yes.
So you would have almost built in a form, one part of your, not the whole thing, but one part of your monitoring done by the simple numbers.
That is correct. It does identify the worker that's entering the information.
Plus, we have taken our 2 lead workers, removed them out of a caseload, so they will go back to second party and review cases and helping train the new workers. So they would not be doing casework per se, but checking, make sure that
Who keys in the information?
all the workers are responsible for it.
The food stamp workers?
Yes.
Clerical will not have any part of that.
Just registration. That's correct.
How will that registration be done?
Well, the registration will be with our current system, current registration system. It's an automated system that we use, and when the client registers at the reception desk, there's a little keypad outside up on the ledge in front of each window, and the client enters his or her social security number in the keypad, so there's no exchange of that information. Nobody can hear it. We don't ask them for their social security numbers anymore. They just put it in. And then if they've already been registered with us, it pulls up their information automatically. If they have not registered with us before, then the receptionist would enter that information in at that point and make them part of the system.
Where does that information go? Like when the client comes in, enters social security number, where does that initial info go?
Where that goes is they're assigned to a intake caseworker, and then an email goes to the caseworker letting them know that the client is in the lobby waiting to be interviewed, and then there's a backup on it if a person has been waiting for an extended period of time. seen, but we're only assigning one client to a caseworker at the time.
Okay, like if I went in and keyed in my social and had already established an information give.
You're already in the system.
Okay, would that go to a certain worker who was assigned to me the last time I was in, or would it have to go through?
It would go to, on an intake, it would go to whoever's next up on the rotation for intake. If you have an existing case, you would be referred to the worker that actually is carrying your case, the ongoing worker. If that worker's not here, then either a lead worker or a supervisor would see the client.
Okay, one of my concerns that I have talked with you about, Bryan, is the amount of the weight that these clients are having to deal with. Okay, you mentioned that if the information goes in and in a certain amount of time it has not been attended to, a supervisor will be.
Gets an email,
Okay.
That's correct.
What period of time are we looking at that happening?
Once it's sent to the case worker, it follows up with the supervisor after 30 minutes.
And then what does the supervisor usually do?
The supervisor would contact the case worker that it was assigned to and make me a phone call or ask, there's somebody there waiting, has not been seen and look into. And that's assuming that the supervisor, is not in a meeting. It goes to both supervisors, my understanding goes to both supervisors of a program area. So if we have two, more than one supervisor can see it. But when, if somebody's at their desk, they can respond to it right away. But it's also the receptionist's responsibility to follow up on those as well, because the receptionist can see right in front who's been seen and who's not been seen.
Okay, in going into the waiting room over in your department, is that first area that you enter for Medicaid, food stamps, Work First, is all of that, I know Work First has moved, but is that all right there?
Yes, we have the three windows identified. As you enter the building, to the left is the Medicaid window. That's at a separate section, separate seating.
That's the far left.
Far left. Straight ahead is crisis programs. And then to the right of that is food and nutrition services, and they're all labeled by program. And then to the far right of the lobby is our child support unit, and they have a separate window as well.
Okay, so if I go in for 4D, I have a window that I go to. How do I register? The same way? I'm trying to get an idea of the food stamp versus the other programs.
Right. All of those are using the LAD system for doing registration.
Which is your social?
That's correct. That's correct.
And it works the same way with your other units that it does?
Correct. That's correct.
At the regional meeting, there was a question raised about cross-county verification. Let's say they moved into this area from someplace else. Isn't NC-FAST supposed to do that?
Yes, we can look into that system and see what a person has been approved for in another county, not another state.
You said you can look in.
The capabilities, it brings up and it shows if they're eligible to have received.
Is it policy to do that?
Yes. I mean, we look at that. That's something we check. We also have to, there's a question on the application that asks the client, are you currently receiving food and nutrition services anywhere
And if they did not tell the truth?
We would still look.
You still have to run your online verification, so you still gonna.
It would show up.
When you do child support, food stamps, Medicaid, you run all those verifications. And you click those boxes, and if they're receiving, it will come up and show you that they're receiving.
And we can see that, but we cannot see it if a client is receiving in another state. There's no federal cross match. So we have to go based on, but now eventually we might find out later, but on a statewide, we will find out, but it's not at the point of application.
Now, if I applied in one county, how long can I apply in another county?
Well, you can go ahead and make an application here if you've moved here, but we cannot approve you. Say you came in the month of October and applied in Pitt County go ahead and make your application at any time you want to, but we cannot approve you and make your benefits effective, say, until November, because you've already received the benefit from Wake County.
So you can do it within a short period of time?
Yes, you could go ahead
Less
and
than 6
apply.
months?
You could, yes. You could apply.
But you cannot receive benefits in two counties. County for that given month. So you can't receive dual benefits.
So you can cancel one and pick up in another?
You will, if, say Bryan said, if you receive in October, then Pitt County would not pick up until November, because you have already received your October benefits in other county. And then we will contact other county for them to terminate your case, and we will pick it up in November.
But you would still use your same benefits card, even though you're in Pitt County and the benefits came from Wake, that card can be used here in the grocery stores. You still have access to the benefit.
Charles?
One question, and it's very sensitive to the public, as Ms. Starkey said. When you hear about the times in the lobby and you carefully walked us through the process and how at 30 minutes it goes to the supervisor or lead person, and it also, you said, goes to the receptionist.
Well, the receptionist can see who's been waiting on the screen. The receptionist sees whether the client has been.
Is there any process, or do they? You know, and maybe that followed up with, or can they, in any way, if the receptionist, does she make contact? If I were the receptionist and Mr. James had been waiting 45 minutes, and maybe he has somebody who was his ride or whatever, and so he is trying to pass that information, does the receptionist, if I were the receptionist, do I say to Mr. James, we see you've been here over 35 minutes, 45 minutes, and it is now moved up to the supervisor, and there will be somebody with you, you know, at first available. Is that contact made back to the customer sitting in the lobby?
That is what is expected of the receptionist, yes.
Okay.
It is part of their responsibility to follow back up with the client, as well as to pick up the telephone and call the worker. Because the ultimate responsibility is, if the person is still waiting, at that point, sometimes emails are not seen because people are involved in interviewing. They're looking at their emails, but then it's time to pick up the telephone and give a call to the worker or to the supervisor.
And I am sure you have some sort of monitoring system where you check or test that to see, is the receptionist, I'm thinking you have multiple employees, but is the receptionist actually doing this?
We have a supervisor that supervises those, that follows up with them on that, yes.
So there is checks and balances at the next step, and that kind of information is important for the public to understand.
Because they get angry sitting out there, and sit out there for a long time.
Much like any medical care, if it's me, it's an emergency. If it's you, it's maybe routine.
Minor surgery.
Yeah, but having said that, I say that not to make a joke on television, but so that the public understands that there is a hard and fast system, and there are monitorings of it and backups.
Occasionally, the clients will call my number, or they will call Bryan while they're in the waiting area to express their concerns if they've been waiting.
They're waiting a long time.
So they will call, and we will deal with them on an individual basis as they call, but the clients have my number.
Yeah, they do.
Yeah.
Do you?
And then I would check with Bryan to see what's going on. I can put up the land log to check and see how long the client been waiting. Because sometimes a person might say they've been there, they came in at 9 o'clock, but it might have been 10 when they came in, so I can check the time that they were registered and who's next on the log to be seen. But you know, everybody wants to be seen when they come in.
Right then.
Right then. So we have to deal with it. And we only have so many people that's scheduled on intake on a given day, because we put half of the staff on a given day doing intake while the other staff are doing the reviews, acted on changes. So sometime, depending on the number, the volume, you might have a longer wait than you would on another day, because
shouldn't we? And then that number decreasing or increasing would tell us if there were trends. I would suggest that that's some way, you have it electronically and on files, and if it's just a simple addition to there, that this resulted in a complaint to a supervisor or a complaint to administrator or what, just to take it and not log it might not be telling us exactly, and I don't mean you're telling us anything wrong, but might not be giving us a portrayal. If that's once a month, you know, or something, or twice a month, somebody had a bad day. If that's three or four a week, 4 or 5 a week, then that tells us a whole lot of people either are not getting the communications out there in the lobby that we think they are in the process. And as long as that number was reasonably consistent or decreasing, I think we're certainly making progress. As one board member, my thought would be to not log that, and just I talk to them would not be maybe the documentation we might want to keep. It wouldn't give us anything to stand on when the public makes a complaint like that, be it founded or unfounded.
And George, another one of my concerns was that a couple of times I have been over to, I call it the Riverside DSS, and this past Friday being the most recent time, and there was only one person working the whole front desk. And I just don't see how it's possible that one person can serve a waiting room full of people in the manner that Bryan says the system is set up to do.
And that's not the norm. Normally there are two, but we had a special circumstance last week. That's not the norm.
And do you have a backup plan if that happens?
Well, we do have backup. The clerical employees that are not receptionists do back up and fill in at the desk. And other people are out. We did have more people working in the clerical area, and we're better able to provide backup. Right now, we have just enough. We have enough to do backup, but if we have somebody out on extended leave in that circumstance, and that has resolved itself, so that was for a brief period of time. We lost 3 clerical positions over the last 3 years in just that one unit. It was a unit of 11 clerical people reduced to 8. So it has stretched our ability by having fewer in number to provide backup. We're providing backup with everybody that's there. But that was not, and it's not normal even on normal circumstances. We have at least 2 people at the desk.
Well, I was using that as an example,
Right.
again, that numerous times people have gone and waited for a whole day, have not been seen that day, come back the next day, and there's something that in your procedure about giving priority if they do have to come back the next day. But like what happens if they can't come back the next day? I don't know, it just doesn't seem to be moving very smoothly.
Okay, that is one specific program that you're referring to. That's the crisis program, and we have 5 workers in that area that take applications for crisis. And what happens is, on days when the weather is, or times when the weather is extremely cold or extremely hot, we have a lot of people come in at the same time to apply for those programs. So take, for instance, we have 5 people taking applications and 70 people come in one day. What the policy says is that they are given an opportunity to protect their application date for that day. We can't just hand out numbers and say we're only going to see this many, come back another day. So we see the clients in the order that they come in, which is what the policy is, first come, first serve. And then clients who have crisis situations, if it's extreme weather, lights are out, and the power needs to get back on, we have to see those the same day. So sometimes we stay after hours to be sure those are seen and those are handled. Anybody that's still waiting is given priority to be seen the next morning, and they are seen before anybody that comes in the next day. And the reason we can't hand out numbers and say we can only see 30 today is because that doesn't protect the client's right to apply and have their application say, I'm working on Tuesday, I can't come back until Wednesday. If I come back on Wednesday and it's another heavy day and we have 70 in, I may not get there soon enough to get a number to be seen either. So that's the only program that we have, and it's not a daily occurrence, but it's something that happens when we have, like, it's not uncommon for everybody to come first part of the morning. That's when they generally come in for that program, and we might have, in extreme times, 50 registered just in the morning. So it's not like the other programs where you have, like Food and Nutrition Services, we have 22 line caseworkers to see clients. In this program, we have 5 social workers to see clients, and it's physically impossible to see 70 people in a day with 5 people and do their applications, because those applications have to be taken and processed within 24 or 48 hours, depending on what the crisis is. So that's the that's the program that you were referring to, where somebody might be scheduled to come back the next day.
I'll offer a comment. I've asked so many questions. I'll offer a comment. This may sound like intense questioning or issue specific, but think how important the information that we have just discussed is for the public, all of the people we serve, to know how many people we have to work with, what kind of cases, how they may come in, flow patterns and things, and maybe this knowledge, if it seems intense here in the questioning, maybe this knowledge going out to the public will be a larger benefit. Thank you for making that explanation.
I kind of was listening to everybody. I have some ideas about some things, and because we've gotten a lot of information, so I kind of wonder, I want you to listen to what I'm thinking, kind of give me some feedback on this. I think there were a couple of issues that were raised that we were all concerned about. I really thank you for going into some of the details. I think one of the things that we were listening for and thinking about is average time. How much time from beginning to end? And we do have that right now, and we know that's going to vary. And I'm thinking that's one thing that we'd want to know, and especially if you're going down there. I'm not sure if you're going down there. This kind of, how you get to go down there, but I think that's a good idea. And you're really adding a different dimension to us on the board. Also, the issues of complaint, because I think that it'll give you some trends. It'll give you some information in terms of what the public is seeing, and I think that's a significant issue at times. I think the issue of the backup plan, which I thought was really very good, but it helped us out to know what that backup plan was. Also, you're talking, I think there were 2 programs you were talking about. One was if I don't get seen today, then do I get first preference tomorrow? And you were saying those are different programs.
Right, that's the crisis, that's for crisis programs, and it's generally assistance with utility bills.
What about if that happens in this program, that if they're not seen today, do they get preference tomorrow?
Food and Nutrition Service, Work First, Family Children Medicaid, they sign their 1295, which protect their data application. And in those programs, we will see them, and if they cannot come in, then it's up to the clients to tell us that they cannot come back, and we will see them that day. So for Work First, Food and Nutritional Service, Family Children Medicaid, the 1295 that they sign protects their data application.
Okay, and one of the other things that I just want to see what people think about this is that I really like your program and your I guess the way that you proceed it down to if this happens, then this happens, and those kinds of things. I'm wondering, with us as board members, would we like to see that so that we can understand? Because you brought out a lot of things that I didn't think about in terms of when the person goes up to the board and puts in their social security number, then it goes to the worker, but then at some point the secretary finds out about it if the person's not being seen. Then at at some point within 30 minutes, a supervisor is contacted. And,
What you're asking is a flow chart
yeah.
of an application.
Right.
And if it has problems, then it's this and this, and how it ties back in. I think
Yeah.
that's what you're asking.
Right, exactly.
If the board understands that, then some version of that, the public that uses it should understand or have access to. And it would let them know what is a legitimate expectation as opposed to, I'm in a rush today, and this is inconveniencing me, maybe that. But I think starting that flow chart, starting with the board, this is how it happens, and if it isn't this in this many minutes, this is how it happens, and this is how, and it would show how that is. Same as if somebody is actually taking the time to call and to hear, then that would be a separate on that, and I think that's one, when it gets to that critical, we should know it. It should not be just, well, if I happen to know George, or my family knows George, and I tell them, look, you sit there so long, you don't hear anything, call George, or, you know, and see if you can get something done. And then we don't know that, because the rate is not, did they call him, but the rate tells us what we need, or how much flow we can process through. And that would tell us that. I think, I'm nervous with just answering it and assuaging or assuring them we're gonna get to you, and then there's no documentation.
Yeah, and one of the things I was thinking, just in a concrete level, is the flow chart that I was talking about, and that Charles brought up. Is that posted outside there so that the person applying can see where they are in that flow chart, and what kinds of things will happen if this happens? Those kinds of things that they can see when they come in.
It is there now, but maybe that's something to work toward.
Yeah.
There is something there that lets clients of food and nutrition services know that we're going through a change and that there may be delays. That's there. People that come in and apply for crisis or emergency assistance programs are informed of that when they register about, that the wait could be long and what the process is. They are informed of that, but there's nothing posted for that program that tells them that.
Thank you, Brian. You've been the point of good questioning.
Yeah, I think that's
tea for Bryan.
Yeah, I think what we as board members really appreciate is that a lot of the information that we want you have, especially in terms of the flow chart, and if you would, really look at incorporating some of those things that I came up with, and that we saw maybe next month. I think that would really be good. But again, really appreciate what you did, especially letting us know early on that there was going to be a change. It's going to slow things down, but eventually it's going to speed things up and make things more accurate. So I appreciate that. Okay, next we're going to go to the director's report.
In the director's report, you have an application that we submitted to St. James United Methodist Church for a spring fling application. This is an application to provide 1 week camp for siblings. At the present time, we have 13 sibling groups for a total of 37 children. And we meet, children get together basically one time a month together. But if we are able to successfully get this grant, they will have 1 week where they will be together in a camping situation, swimming, doing things together as a family group, sibling group. So we have applied for this. Hopefully we will find out something about this. I was not aware that we had 13 sibling group for a total of 37 children. That is a lot of children that have been broken up, families broken up, that they're not together. You might have one child here, another child there. But this way they will be able to get together at least for 1 week for activities, so we have put in for that. Also, our next board meeting will be November the 13th. It will be on a Tuesday as opposed to a Monday. Monday is Veterans Day, so we will not meet on Monday. And then we have the Fatherhood Initiative scheduled for this Wednesday, October the 10th at Cornerstone. So if you're able to come, we appreciate that. I think we have a couple of board members scheduled for the Institute for this month. So thank you to the board members that they go, and hopefully they'll be bringing back information that they can share with the group.
Is this something that people could make donations to help out unite some of these siblings?
Yeah, we could once we, let us find out whether or not we get the grant. If
Okay.
not, then we'll get back,
Okay.
see how we can make it work.
Yes, we have a line item for that. We're very open to do.
Open to donations, okay.
Yeah.
All right. Okay, well, next we're gonna look at, going into, closed session.
Mr. Chairman,
Oh, no, we need to make a
you gotta
motion
read it
first.
first.
North Carolina General Statute 143-318.11 regarding closed sessions, Section A, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or of the United States, or not considered a public record within the meaning of Chapter 132 of the General Statutes.
I'd offer a motion that, based on North Carolina law and the items before us, that we go into closed session.
Second.
Okay. The motion has been made and seconded. All in favor say aye. Aye. All those opposed say nay. We're now in closed session.
Check the next one.